Healthcare is essential. During a crisis, it becomes even more critical. Crises like pandemics or natural disasters put immense strain on healthcare systems. This leads to a surge in demand for medical services, equipment, and personnel. Healthcare contracts play a vital role in ensuring a timely and effective response to such emergencies. Contracts provide a framework for collaboration. They facilitate the allocation of resources. They ensure the availability of essential medical supplies. Without these agreements, healthcare systems would struggle to cope with the overwhelming demands of a crisis. These contracts are not just about logistics, they are about saving lives. They ensure that hospitals have enough beds. They make sure that healthcare workers have the equipment they need. They guarantee access to life-saving treatments. In essence, healthcare contracts are the backbone of a resilient healthcare system. They are crucial for navigating challenging times and safeguarding public health. Healthcare crises can emerge in various forms. They often strike unexpectedly. Pandemics, like the COVID-19 outbreak, are a prime example. These global health emergencies overwhelm healthcare systems. They lead to shortages of beds, ventilators, and essential medical supplies. Natural disasters, such as hurricanes or earthquakes, can also create healthcare crises. These events can damage hospitals. They can disrupt supply chains. This leaves communities vulnerable and in dire need of medical assistance. Staffing shortages represent another significant crisis. A lack of qualified doctors, nurses, and other healthcare professionals can cripple healthcare delivery. This is particularly challenging in rural areas or during disease outbreaks. These crises underscore the importance of preparedness. A robust healthcare system must be ready to adapt and respond effectively to these challenges. This includes having the necessary contracts in place to mobilize resources rapidly. The healthcare industry relies on a complex web of contracts. These agreements cover a wide range of services and products. Understanding the different types of contracts is crucial. This is especially true during a crisis when time is of the essence. Government contracts play a critical role in healthcare emergencies. These contracts are agreements with local, state, or federal agencies. They are essential for disaster relief, public health initiatives, and disease control. Private sector contracts involve agreements with healthcare providers, insurance companies, and medical suppliers. These contracts are crucial for maintaining the day-to-day operations of the healthcare system. Temporary staffing contracts become invaluable during crises. These agreements allow healthcare facilities to quickly increase their workforce. They can bring in qualified professionals to address staffing shortages. Medical supply and equipment contracts ensure a steady flow of essential materials. This includes medications, personal protective equipment, PPE, and medical devices. Navigating this complex landscape of contracts requires expertise. It demands careful planning. It is crucial to understand the terms, conditions, and legal implications of each contract. This ensures a smooth and efficient response during a healthcare crisis. Government contracts are essential for responding to healthcare emergencies. They provide a lifeline for healthcare providers. They ensure access to critical resources. These contracts take on various forms, each with its significance. Local government contracts often focus on community-level response. This includes setting up testing centers during a pandemic. It may involve providing emergency medical services after a natural disaster. State government contracts play a broader role. They might involve coordinating the distribution of vaccines or medical supplies across a region. They might support the establishment of field hospitals during a crisis. Federal government contracts often address national or international health emergencies. The Centers for Disease Control and Prevention, CDC, for example, relies on contracts to support disease surveillance, research, and response efforts. These contracts provide financial resources. They offer logistical support. They are instrumental in ensuring a coordinated and effective response to healthcare crises. Section 5. Private sector contracts, meeting surge demands. Private sector contracts are essential for maintaining the day-to-day operations of the healthcare system. During a crisis, these contracts become even more critical. They help meet the surge in demand for medical services and supplies. Hospitals rely on contracts with private insurance companies. These contracts ensure that patients can access the care they need. They cover the costs of hospital stays, surgeries, and other medical treatments. Pharmaceutical companies rely on contracts to distribute medications and vaccines. These contracts are crucial for ensuring a steady supply of life-saving drugs, especially during a pandemic. Medical device manufacturers rely on contracts to provide hospitals with essential equipment. This includes ventilators, imaging machines, and other life-saving devices. These contracts become paramount during a crisis when demand for these devices can skyrocket. The private sector plays a vital role in healthcare delivery. Contracts within this sector ensure that essential services and supplies are available when and where they are needed most. Section 6. Temporary staffing and medical supply contracts. Healthcare crises often lead to a surge in demand for medical professionals. This is where temporary staffing contracts become invaluable. These contracts allow healthcare facilities to quickly increase their workforce. For example, during a pandemic, hospitals may need to hire additional nurses. They might need respiratory therapists or other specialized healthcare professionals. Temporary staffing agencies can quickly connect these professionals with facilities in need. Medical supply contracts are equally critical. During a crisis, hospitals may face shortages of essential medical supplies. This can include PPE, medications, or even basic medical equipment. Having contracts with multiple suppliers can help mitigate these risks. It ensures that hospitals have access to the supplies they need. These contracts can be the difference between life and death for patients. Section 7. Positioning yourself for success. Strategies for securing contracts. Securing healthcare contracts, especially during a crisis, requires careful planning. It requires a strategic approach. Here are some essential steps to position yourself or your company for success. First, build a strong portfolio. Highlight your experience, showcase your expertise. This could include your track record of success in responding to past crises or your specialized knowledge in a particular area of healthcare. Second, understand the specific needs of healthcare institutions. What are their pain points? What are their challenges? Tailor your proposals to address these needs directly. Demonstrate how you can provide value and solutions. Third, emphasize adaptability and flexibility. During a crisis, situations can change rapidly. Healthcare institutions need partners who can adapt to evolving circumstances. Demonstrate your willingness to be flexible and adjust your approach as needed. Section 8. Leveraging government resources and support. The government plays a crucial role in supporting healthcare initiatives. They provide a range of resources that can be invaluable during a crisis. Understanding these resources and how to access them is essential. Grants are a significant source of funding for healthcare projects. These grants can support a wide range of initiatives. This includes developing new treatments, expanding access to care, and strengthening the healthcare workforce. Emergency contracts are another vital resource. During a crisis, the government can expedite the contracting process. They make it easier for healthcare providers to secure the resources they need quickly. This streamlined process can be a lifesaver for hospitals and healthcare systems facing overwhelming demand. Navigating the bidding process for government contracts can be complex. Familiarize yourself with platforms like sam.gov, the official website for federal government contracting opportunities. Understanding the intricacies of government contracting can significantly increase your chances of securing these contracts. Section 9. The power of networking and partnerships in healthcare. Networking and partnerships are paramount in the healthcare industry. Building strong relationships with key stakeholders can be invaluable, especially during a crisis. Joining professional healthcare organizations provides opportunities to connect with peers. It allows you to stay informed about industry trends. Attending industry events, conferences, and webinars is another excellent way to expand your network. Collaborating with other healthcare providers, suppliers, and organizations can strengthen your position. By pooling resources and expertise, you can offer more comprehensive solutions. This collaborative approach can make your bids more competitive. Remember that building relationships takes time. It requires effort. Nurture your network, stay connected, engage with your contacts regularly. A strong network can be a lifeline during a healthcare crisis. In conclusion, mastering healthcare contracts during a crisis requires a multifaceted approach. It demands a deep understanding of the healthcare landscape, the ability to adapt to changing circumstances, and a commitment to building strong relationships.